Hey everyone, hope you're staying safe and staying well. In the last few videos of this channel, we've been talking to doctors here in Los Angeles and over in New York City to get a sense of what's going on the front lines of this COVID-19 pandemic. In today's episode, we talked to Dr. James Mattson, a New York City emergency room doctor, to get his firsthand experience treating COVID-19 patients. This episode and the last one I made are really special for a couple reasons. For one, the doctors we're talking to are giving us a really intimate portrayal of what's happening on the front lines. It's easy to boil this pandemic down to just numbers of infections or number of people who died, but behind every number is a person. Each number represents a life that's been affected by this virus. And that's what Dr. Mattson reminds us of today. The other reason these videos are special is because these guys are my friends. We went to medical school together, and I'm just so proud to see them fighting this pandemic head on. You can find timestamps for each section of this video by clicking the description below. If you find this video helpful, please make sure to share it with your friends and family, and make sure to hit that like button. It will help other people find this video. Welcome to another episode of Life Prescription, everybody. I hope you're doing well. I hope you're staying safe, and I hope you're staying inside. New York City has been by far the hardest hit area in the United States by the COVID-19 pandemic. And what the healthcare workers are going through there are completely unprecedented in our lifetimes. And so in the last episode, we talked to a palliative care doctor in New York City. Today, we're talking to an emergency room doctor, Dr. James Mattson. He's working on the front lines in New York City, and we're very lucky to have him today so we can learn from his experience. So James, thank you for joining us today.
Hey, Sri, thanks for having me.
How are you doing, man?
Doing all right. Yeah, doing all right. Just like everyone else in the country, taking it day by day.
In addition to being an amazing doctor, James is one of my very good friends. James and I went to medical school together, and we've known each other for many, many years. And the last time, James, I saw you was we were actually on a ski trip together. And that was just a few months ago. Could you have ever predicted that we'd be dealing with this right now?
Yeah, it's crazy that so in just 1 month from that ski trip was when things were really starting to escalate here. It's crazy in hindsight that we were able to just like do a trip together and travel and live normal lives before all this happened. I reminisce a lot on that trip or about that trip because those were the good days.
Those were the good days. I'm glad we got to go. And I just cross my fingers that there's going to be some advancement, some improvement that we can get out there again soon. Yeah. So hopefully this time next year we'll be able, or inside a year we'll be able to get out there.
Sure hope so.
So James, you're an emergency room doctor. You're working in New York City. Before we get into how the COVID-19 pandemic has affected your job and affected, countless people in your city, I want people to get a sense of what do you do on a day-to-day basis? What was your job like before the pandemic started?
Yeah, it's a great question. I actually get that question a lot. So as an emergency room doctor, you're literally the doctor in the emergency room. When you go to an emergency room, in most parts of the country, the first doctor you see is going to be an emergency room doctor. So on a day-to-day basis, you take care of anything that anyone would come to the emergency room for, whether it be pain, injuries, heart attacks, strokes, trauma, motorcycle accidents. It's all over the gamut. And part of the fun and the difficulty of the job is that you have to be ready for any one of those things. Before COVID, my job as an ER doctor in New York was already pretty intense. Being an ER doctor in New York is a very, very busy experience. Every hospital in New York at any given day, even before COVID, was already full of patients, and by virtue of that, every ER was already full of patients. So on a given day, let's see 30, 40, 50 patients with complaints ranging from an infected ingrown toenail to a heart attack or someone who had cardiac arrest at home. So it's a very large gamut of complaints and issues that you deal with. And by virtue of that, I think we're very well prepared for something like the current situation. But yeah, New York in particular, there's a lot of people here, and ERs are very busy. So like trying to handle a extra surge of people coming from a pandemic was something that has been pretty difficult.
I'm always impressed with emergency doctors at just how much, like how broad their job description is. Like you're saying, you can see someone who comes in for a heart attack, but you're also seeing like children, babies, you're delivering babies. It's just all across the spectrum of things that you're able to do. And so I work a lot in this year in the emergency room alongside the emergency doctors as a hospitalist. So I'm getting to witness that firsthand, just how wide their skill set is, and seeing how you guys have rallied together for and during this pandemic has just been awe-inspiring. And so, I mean, hats off to you, man.
Yeah. And I mean, frankly, it's not only just emergency room doctors, it's people like you, hospitalists and entire hospital systems that are kind of coming together really nicely. And yeah, there's a lot of camaraderie that comes with it. So it's cool in some sense, seeing all those people come together, because that sense of camaraderie and being able to handle whatever comes to you is kind of what we live and breathe in the emergency room, and seeing entire hospital systems kind of live that is actually kind of inspiring.
It is inspiring. But the other thing that you talked about was that even before this, you're basically running at capacity.
Yeah, exactly. Yeah. I mean, any given day in the emergency room, there's probably 15 to 30 patients just waiting for a bed in the hospital because the hospital itself is already full. And because of that, the beds in the emergency room are sometimes already completely full when I walk in at 7 a.m. to start my shift. And that's even before we get the typical surge of people coming through. So it's impressive, really, how at least the hospitals I've been working at has handled this incredible surge of people coming through.
So that's what I want to get into next. So thankfully, across the country, in New York especially, it seems that we're over the peak in terms of new infections and deaths. But that doesn't necessarily mean we're out of the woods yet. Doesn't mean that we can end our lockdowns, end our social distancing. Just yesterday in the United States, there were 2,000 people that died in a single day. And so James, I want you to describe how things were in your hospital as the COVID-19 pandemic was ramping up and through the peak.
Yeah. So on a more personal kind of like trajectory in terms of what I was doing as things were ramping up, I just because of how my schedule worked out, was on a vacation sort of for kind of the first week or so that things were ramping up. So it was, I think, the most scary thing about what happened is just how quickly things ramped up. I went from finishing my last shift before my vacation, not having any patients, no COVID positive patients in New York City, only having a few cases that we were maybe kind of considering that they could be potentially a patient that has COVID, to a week later, our hospital starting to get overrun with people in respiratory distress from COVID. And at that point, there were hundreds of people in New York City that had tested positive and filling the hospitals because of that. I think that was the most scary thing in the first week or so. Things were ramping up. And then once you kind of get over the initial shock of how quickly things are moving and things are happening, the next kind of phase of things was trying to just handle the insane surge of people coming through. And that's where, thankfully, a lot of the public health, public service announcements and that sorts of things about flattening the curve, even before governments set in policy, stay-at-home policies, that's where those things started to really help us out, because the surge that we saw, even with policies in place, was insane. Our hospitals, thankfully, the two hospitals I work at in the New York Presbyterian system, mobilize resources like I've never seen before, and it's been insane how well they've been to mobilize what they have. They closed out all elective surgeries. They cleared out all patients that were stable enough to be discharged. They shut down clinics, entire services. They mobilized rooms that were not ICU capable to become ICU capable. They used all the operating rooms to be ICUs. They created entire wings that did not previously have hospital rooms to become ICUs. So the hospitals did a lot in the first couple of weeks to mobilize things, but even then, it was impressive how quickly this virus just kind of took over the city. We were seeing oftentimes a patient coming in with respiratory stress every 40 minutes to 1 hour in each emergency room that we work in. And that's usually something it's something that the entire emergency room or wing of the emergency room mobilizes for, with all the nurses, all the staff coming together to stabilize a patient that's on the brink of death. And that was happening multiple times per hour for weeks. So it was physically very, very taxing, and also trying to navigate that in the context of infection control, trying to minimize spreading of the disease, trying to wear and don and doff the proper personal protective equipment. It was overwhelming a lot of times to try to do it with all the moving policies and all the increased numbers of patients that were coming in with the disease. There were days when you walk into the emergency room, and usually on any given day before COVID, there would be a dozen patients in a particular area of the emergency rooms of the hospitals I work at. There were days where we were coming in and there were already 45, 50 patients in the day, and that's even before the day starts. So things were very, very difficult from just a pure numbers perspective. Then on top of that, there's the fact that these patients get very, very sick. Any single person that gets infected from COVID has the potential to deteriorate very, very quickly. Thankfully, that's only about a fifth of the population that get infected, but of those 20% or so that do get really sick from this, they get sick very, very fast. So we were seeing an incredible surge in the number of just critical patients that we were seeing. The patients that come in for respiratory stress from COVID need immediate stabilization with maximum ventilatory support, with oxygen of different modalities, and all in the concept of trying to minimize exposure risk to staff and the other patients in the area. So patients were getting intubated, which means a breathing tube put down and being put on a ventilator at certain times, like every 2-3 hours in a day. So that meant using up anywhere from 10 to 20 ventilators in any given day. And when that's happening, and our hospitals thankfully did an amazing job to mobilize our resources to acquire additional ventilators, when that's happening with a finite number of ventilators, there's always that thought in the back of your mind of what you would do if there was a ventilator to decide on between multiple patients. Thankfully, we never got to that point. There were a few nights I worked where we were down to single-digit ventilators in the hospital, but thankfully it never got to the point where I was deciding between patients which one would get a ventilator.
Wow.
So the surge was a lot in numbers, a lot in critical patients, and because of that, a lot in just utilizing the already stretched resources of the New York health system. The initial few weeks were very difficult.
James, what you're describing, even to me, I'm in healthcare, but what you're describing is eye-opening. I see it on the news. I see numbers, I see several thousand people a day dying, hospitals overrun, but you're giving a very personal account. And what you're describing is that as you saw this thing coming towards you, as you saw it barreling down towards you, your hospital mobilized, people rallied around each other, the city rallied together to start socially distancing to try to flatten the curve. But despite all of that, it still almost destroyed you. It almost took over the hospital system, a hospital system that's already running out of capacity, max capacity day to day. And what you're describing of just the personal level of people getting sick, severely sick, being put on life support almost on an hourly basis for a couple of weeks is honestly unimaginable to me.
Yeah, it's incredible. I mean, you hear the numbers, you hear of thousands of people dying in a day, you hear of thousands of ventilators being used and required by a state. I think what oftentimes gets lost on that is that each single number is a patient that is there in front of you that you have to try to decide what you can do to save their life and try to guide them through a very difficult moment. I mean, unfortunately, you can't always do that. So then one of those numbers that eventually gets chalked up into the thousands that unfortunately die, each one of those is a person you have to walk through the last moments of their life, a family member or multiple family members that you call and break the news. It's physically very, very difficult, but more so, I think, the emotional toll that it took on everybody that was there in those first couple of weeks was just immense.
If it's okay with you, I want to talk about that. So there are a lot of unintended consequences of this pandemic. As we were talking about, the hospital system's already at max capacity, and now it's being stretched beyond its limits, right? And you hinted at it when you were talking about how, healthcare workers are rallying around. At the same time, there's a lot of these stresses. You're worried, are you yourself going to get sick? You're worried, are there enough supplies to treat patients? And now you're describing to me having to call families, having to walk a lot of different people, a lot of your patients through the last moments of their life. So if you don't mind my asking, how has that been for you? How has that affected you?
Yeah, I mean, on a personal note, it's in a way a part of the reason we get into this job in the first place is to form these personal connections and have these discussions and connect on a personal basis. I think on top of just the sheer frequency that we had to do this, the emergency room or as like for frontline providers was the lack of humanity in it all. Usually like a goals of care, meaning end of life discussions, is not something that's unfamiliar with us as physicians, or especially in the emergency room. We do it regularly. I think I'm fairly comfortable with it, and it's oftentimes very impactful on my appreciation for the value I provide to the community. But part of the just pure evil side of this virus is that when a patient comes in respiratory stress, suspectedly from COVID, our hospital is not allowing visitors in because of the risk for spreading the infection. I'm wearing personal protective equipment from head to toe. My entire face is covered. It's just my eyes showing. So a normal personal conversation you have in these moments is just based on eye contact and a muffled voice coming from a garbed man that's in front of you. So that's the humanity. A lot of the aspects of the humanity that we have as part of our job is just lost in that moment. You can't make as well of a personal connection with a patient and their family as you normally would in those situations. And that's what's so tragic in these moments is that so many people are dying or close to dying. And in times where you get into the job to try to guide them through that moment, you can't do so in a way that you feel comfortable as a humanitarian, as a person. So that's what's been very emotional for all of us about it. On a more personal note, it's like something that to get through in the first couple weeks, honestly, like some of my colleagues reflected daily about it, writing journal entries, recording videos. Me, myself, I talked with my colleagues about it, and then I just kind of went on to the next day. And like, people had their different coping strategies. I think mine was just looking on, moving on, trying to prepare myself for my next shift. And it got me through those first couple weeks. But honestly, there's probably a lot of reflecting for the next several months that's going to come of this, and something that you alluded to, a lot of the psychological effect and toll on this, not only on healthcare workers but all of society because of this, is something that's only going to start to continue to unravel. I mean, one thing that's very fresh on my mind is a colleague, an attending of mine, Dr. Lorna Breen, unfortunately took her own life this week. I'm still a little bit in shock about it. All of our departments and all of my residencies still trying to process what happened. And suicide is always a difficult thing with multiple different factors that play into it, but you can't help but know that this virus, this pandemic, absolutely had a role in that. And that's just an example of the toll this is taking, not in just the death counts, but just on society as a whole.
James, I'm so sorry to hear that. That honestly breaks my heart to just think about one of your colleagues, one of your attending physicians, basically, I mean, I don't want to speak to, anything other than just just a tragedy for society, tragedy for everybody, all of her patients, her family. And so our deepest condolences go to her.
Yeah. She was a wonderful physician, one of the most respected leaders in our department. And yeah, it's a shock to all of us, and a huge blow for us at this time. Yeah, she will be very dearly missed.
And yeah, it's just the personal toll that you're describing on your patients, on the staff, is just staggering. And there's going to be a lot to unpack as a community, as society at large, but healthcare workers too are going to have to unpack a lot of this. I think there's going to be a lot of issues that we're going to be struggling with. Like, it's almost like PTSD, right? You guys are in the middle of basically war, right? You're seeing this just unimaginable tragedies daily, and so I hope that things are slowing down. You're able to kind of walk a little bit more slowly in your day-to-day life, and that you yourself are getting the support that you need. You and all of your colleagues are being well taken care of, because we're going to need you to take care of us for any kind of emergency situations that we might find ourselves in.
Yeah, one of my co-residents, he's also a fourth year EM resident like me. He's an Iraq war vet. He served as was in Iraq for 6 months, I think it was, and he compares it, even before COVID, he compared working in the emergency room to being deployed and at war. You're at war with disease, you're at war with illness, you're at war with some impacts of society. But even now, like, he's saying this is the exact same sort of life-changing experience that you need to process, and you need to take what you can from it, and it's going to have an impact on how we approach life and look at ourselves. And yeah, he's been kind of a shining light through all this, and it's been helpful to have his perspective in that. Our residency also, pretty early on, we had this was the last week of March, even before things were really getting crazy. We had a talk from Captain Robert Newsom, who had a decades-long career with the Navy SEALs, and he spoke on some things that he would tell his teams to get them through difficult times, and it was incredible how much of it just rang true. And like, helped us through those first couple weeks.
That's actually very, very insightful. So we're using these metaphors like you're in war, you're on the battlefield, but an actual Iraq war veteran and an actual Navy SEAL, this Iraq war veteran is actually one of your doctor colleagues, is saying even before this, emergency medicine was like war, but now this is practically like the similarities are uncanny. And so I'm happy that you know, through all of this, you have people that can at least share parallel life experiences, and hopefully together we can kind of move towards some semblance of normalcy. But speaking of moving together or moving forward in some semblance of normalcy, James, you yourself got coronavirus. You yourself got COVID-19. And look at you now. I mean, you're looking vibrant.
Recovered.
Yeah. So what was that like to be?
Using the word survivor is a little weird to me. I don't like to think of it that way because, I mean, I got sick. As far as symptoms, I had the worst headache I had ever had. I had aches all over my body, and then I had fevers for 10 days straight. Fevers to 101, 102, waking up in puddles of sweat. And then the last few days I started to have some shortness of breath as well. Thankfully, I got past it. I didn't get sick to the point of needing to go to the hospital. And the people I was with, I was with other people that were also sick, and they all got past it and now are past the infection, and thankfully did not deteriorate or need hospitalization, or thankfully not any intensive care or anything like that. As someone who works in an emergency room, it's a little ironic for me that I actually got it while I was on vacation, just from the community, which is just more telling that I mean,
you shouldn't have gone on vacation. You should have just stayed in the ER.
yeah. And I mean, there's this thought now that with all the thankfully we have sufficient supplies now and enough PPE to stay protected while we're working. You're probably more likely now to catch it from the community in New York, at least, where it's just everywhere, than you are at work. Anyone can get this. I got it just from being out in the community, and then in part because of that, while I was out sick, the weirdest thing about it all was the sense of guilt I had for getting sick while I wasn't even working, while I wasn't even being as exposed as a lot of my colleagues are, and guilt for just being away from being in the thick of things when I'm just helpless at home, not helping out my colleagues, my friends, when they're going through very trying times. Thankfully now I've on the other side of illness, and I've fully recovered, so I have a little context into cases that are a little bit more mild from some personal experience, but I have no idea what it's like to be sick to the point of needing to be hospitalized, needing to be intubated or put on a ventilator. So as far as being like someone who's gotten through COVID, I didn't go through the worst of COVID. I didn't go through what many patients and their families are dealing with, and there's a little bit of guilt in the back of my mind because of that.
I think you're being too hard on yourself, James. You got COVID, right? And just like the overall statistics, you know, you're young, you're healthy. The vast majority of people aren't going to have to interact with the hospital. Right now, it's about 80%, like you described, are going to be fine, just going to be hanging out at home with no major symptoms or mild pneumonia. 20% of the people may interact with the hospital, and about 5% of those may end up in the ICU. But still, you went through this. It must have been, pretty scary. You're an emergency doctor. You're seeing people get sick. That must have crossed your mind. The other thing I think, James, is it sounds like you have survivor's guilt. It sounds like you know, you've seen people go through much worse disease, right? You felt guilty about not being there for your colleagues, but you were, James.
Yeah,
You recovered. You went back to the hospital. You're there now. I think
yeah, that's
you're
something
hard on yourself,
we
but
talk about a lot, and
yeah.
usually just joke about, but yeah, I
Hmm.
mean, there definitely is a sense of survivor's guilt that comes with it. Um, in part because, like you're saying, yeah, we're seeing the worst of it in the emergency room. We're seeing the 20% that are very, very sick. Um, but yeah, like you said, it's something that anybody can get, and most of the times, it's something that you can get through. You'll feel terrible for 2 weeks, which I did. You'll feel like you have a loss of your exercise capacity, which I definitely do. But you'll come out on the other side of it, and hopefully, I mean, we'll still see about what long-term sequelae come of it, but it's something that most people can get through. So it's helpful to be mindful of that, but also mindful of the things that do happen, to the things that get to the patients that get very, very sick from this. I was lucky enough to have a pulse ox sent from my sister, who is also a physician. So we were able to check our pulse ox, or meaning our oxygen saturation, the amount of oxygen in our blood, on an hourly basis if we wanted to see if we were starting to get worse. And that's not a benefit that most people have. So as far as knowing when you need to go to the hospital or when you really need more help with this, it's sometimes difficult to know exactly. So yeah, I think that's one of the kind of shades I have on my perspective from approaching this disease. Is I have an idea of the red flags, the things to look for, and for us, it's mainly your oxygenation, how much oxygen you're getting into your system, and the symptoms go along with that. A sensation of feeling short of breath, out of breath, is the thing we typically tell people. And if it's getting to the point where you're sitting there and you feel like you've just walked up 3 flights of stairs, it might be worth at least getting your oxygen saturation checked from a pulse ox, or even in an emergency room.
We are extremely happy that you have recovered. And it's actually very interesting to see your insight as, I'm going to say it, as a COVID-19 survivor, as a coronavirus survivor. And you have this now insight as both the doctor and the patient. And so that, I wonder how that's going to help you relate to the experiences that your patients that you're seeing are going through. So with that, James, I want to end on you already just gave us a lot of good advice about when you should start to seek help if you're developing symptoms. But I want to get your thoughts on what message do you have for other places in the country, places that are either ramping up in their cases. For example, here in Los Angeles County, we've been very fortunate to have flattened the curve early on, but our numbers are increasing very, very slowly, and that's happening across different parts of the country. So what are your thoughts for places that are either waiting for surges or experiencing increases in the number of cases that they're seeing?
Yeah, I think for me, having a life in New York and also my job as an emergency room doctor in New York, it's kind of striking how those two lives overlap very little, even before COVID. But now, even with COVID, with it being on everybody's mind, it's difficult to comprehend the amount of stress it puts on the hospital system, the amount of sick patients we're seeing on a daily basis, and the amount of just toll that it takes on everybody that's working, and the families that are dealing with this, with their patients and with their family members in the hospital. It's easy to get frustrated about staying at home, being locked up. But it is working. Like you said, they're flattening the curve in California. Even though you don't see it on a first-hand basis. I've seen it personally, how things have tapered off after the stay-at-home orders went into place. As a community and as a whole, like, staying at home, being conscious of the collective efforts of everybody to try to fight this disease is having an effect. Even if you're not seeing it on a day-to-day basis, it absolutely is having an effect. Even though, as we're on the tail end of the surge in New York, the hospitals are still completely full. We still have over 150 patients on ventilators in each hospital that I work at, which is 5 times the number of people that are normally on ventilators. So when these patients get very sick, they get sick for a long time. So the hospitals are very full. So like you're saying, the death numbers are thankfully declining. The new cases are thankfully declining where I'm at. But that doesn't mean that the hospitals have any increase in their capacity to help serve these patients. Our hospitals are still completely full because people are on ventilators, unfortunately, for multiple weeks. So it's going to be a while before we get back to a normal from the hospital perspective. So I think as a general population and community perspective, it's going to feel like an eternity because you may not see on a day-to-day basis what's changed or what's different about what you're doing by staying at home, but it's definitely felt from the healthcare system.
Well, I hope that was enough to convince most people to try to stay at home as much as possible. You can't get the virus if you're not interacting with other people. And so if you're at home, if you're staying, at least 6 feet away, you're wearing a mask, we'll get through this together in a much quicker time than we could, and with much less pain than if we all, went to the beach, went to, the restaurants, etc. So if not for anything, do it for James. Do it for Dr. Mattson. If you get sick, he's going to have to treat you anyway. So James, this has been amazing. Thank you for your insight, and I hope everybody at your hospital has the support that they need, to help unpack all of the stuff that you guys are seeing. And if there's anything I can do, never hesitate, man. Text me, call me middle of the night. We're here for you. I
appreciate it, man. Yeah, I know you're always there for me. So you sent me those N95s in the first week of this happening, and it carried me through. And I know you're there for me, man. Appreciate it.
Yeah, I wasn't using them, so I figured I'd send them to someone who needs them. James, take care, and I'll chat with you soon, okay?
All right, Chief.
Thanks again. Bye.